Open Door was started about 40 years ago when our first client came in to get tested for sexually transmitted infection. From that time, we were able to provide counseling services to them to reduce their risk. From that, when there was a test developed for HIV, we thought it would make perfect sense for us to start testing for HIV. Along the way, people's needs started to grow. People didn't want to go into Chicago, and they kept telling us that we want services here in Elgin and in Aurora.
A unique way of treating people at Open Door. As an agency, we try to treat people as a whole. We have a circular model of medicine where the client is in the middle with all the services that they may need around them. So we try to do a holistic approach to medicine. In the early intervention services, we use a peer-based model to provide early intervention services, which means the people that are providing those services are also people that are living with HIV. So they can help maybe somebody that's newly diagnosed or somebody that's having some issues with engaging in care, kind of navigate that system and have some insight onto it that maybe that their provider or their case manager may not have.
Treatment at Open Door is slightly different than if you go to a private doctor. Here we have behavioral health therapists, we have nutrition, we have case management, we have prevention services. So everyone is assigned a team when they come in. So you will see the same doctor every time that you come in, most of the time. You will have your nurse, your medical assistant, any other support individuals that dependent on what your treatment plans dictates.
My test came back positive, so man, it's just at first it's hard to swallow, but doctors were really quick to reassure me, and then I'm lucky I got to be here in Elgin, and then we have the Open Door here. Usually you got to go far for something like this, you know. This is 10 years ago, so I had the Open Door, and it was down on Chicago Street in the big, huge old building, the big old offices. But yeah, I've been coming here, and then we got this new location up here, and it's awesome. Like, if anything, this is the place to be right here.
I think the Open Door clinics helped me because when he told me that he was HIV positive, I'd have to say I was full of anxiety and scared. He took me right to the clinic, and I talked to one of the case managers, and they reassured me about the condition, taught me about it. There's things I didn't know. I instantly assumed that I would get it because, like everyone else, they're scared. But I don't have it.
And you won't get it.
And I won't get it.
Serodiscordant couples, we have individuals who come in for services who one's negative, the other one's positive. We want to make sure that that negative partner stays negative.
Our Client Advisory Committee is a group of clients that provide input to our programs and services here at Open Door. They also do a lot of outreach and speaking in the community, and they organize events throughout the year. Like we have bowling events 3 times a year with the Client Advisory Committee organizes, and it's free for clients, their friends, and family. They also do a holiday party, and we work with the church in Geneva that helps us with a family picnic in the middle of August. So our Client Advisory Committee is very active in planning events for our clients to kind of address those issues of stigma and isolation that people living with HIV may face.
Open Door recently found out that our clients were homeless, and so we needed to address the housing needs of our patients. In doing so, we were able to get additional funding to help us to house people. If people lack housing, then they are not going to attend to their healthcare needs, taking their medications and seeing their doctors. So we see housing as healthcare.
Open Door Health Center has expanded to focus on housing because we see a need in the HIV positive population for housing services. There's a correlation between stable housing and viral suppression. And so housing, if we can get our clients stably housed, then we can work on getting them virally suppressed, which then will help us reach the ultimate goal of 0 people newly infected and hopefully someday 0 people with HIV.
I'm most proud of at Open Door is our ability to integrate ourselves within the community. So we're going out there and we're talking to folks and we're making sure that they understand who we are. And again, we're kind of peeling off the stigma of what Open Door does.
I see us continuing to increase our service lines, getting more people housed, getting more people pre-exposure prophylaxis so that we can get to functional zero, so that there are no new infections out in Kane County.